So this session is really looking at what the health sector can do to tackle air pollution. We think this is a really, really vital discussion for the health sector. We know the health sector can play a role in terms of leadership in reducing emissions in its own sites. We know that health professionals can play a role in terms of informing their patients, particularly as trusted individuals within society. And we also know the health sector can play a key role in terms of supporting policy measures on air pollution. In terms of what we'll cover in today's session, so we're going to be looking at examples from hospitals and from health professionals who are leading the way in this area. We're going to be looking at the Clean Air Hospital Framework and also new piloting projects which are working to look at how we could roll out a national campaign to support training on air pollution with health professionals. Joining us for today's panel, so we have Nick Martin, who is the Head of Sustainability and Environmental Management at Great Ormond Street, and also Laurence, Bourton, Communications Manager at the UK Health Alliance on climate change. So very, very happy to have you both with us. And we're going to start today's session with Nick Martin, so talking about experiences from GOSH in terms of developing the Clean Air Hospital Framework alongside GAP, and really practical experiences from a hospital of ways that they have implemented supporting clean air around their hospital site. And then we're going to have some specific kind of Q&A immediately after that for people who have questions about the framework. And then we'll focus a little bit more in the second half of the session on what we can be doing to communicate with our patients. So I will hand over to Nick. And Nick, thank you very much for taking your time out of a busy schedule to join us this afternoon.
Hi, Catherine. Yeah, no problem at all. Can you hear me?
I can, yes.
Great. Hi, everyone. So yeah, I'm Nick Martin. I'm the Head of Sustainability at Great Ormond Street Hospital. Yeah, it's a real pleasure to be involved today and get an opportunity to share some of the things that we're doing and hopefully create some collaborative opportunities and everything else. So just to begin with, I'll draw your attention to the beautiful collage on the screen that was made by some of the children in GOSH Care. You've got a vision of their clean air future there for the planet. There's lots of trees, there's cycling, I think there's scooters and swings, lots of bees, lots of planting in general. So this is something they made with our play team as part of the engagement process, and we'll go through some of that, but I think it's rather beautiful. Okay, so I'm trying to move to the next page. That's currently not happening. Okay, so I'm going to run through the Clean Air Hospital Framework and what it is. Next, how we created it in a collaborative manner. That was really important. And again, if it's being replicated, something similar would be done. And the impact of its implementation in GOSH so far. And again, it's all very replicable. And then finally, some of the next steps that we're going to take. And throughout this, look out for the little drawings here. This is another one from some of our children. Okay, next page. Okay, so what is the Clean Air Hospital Framework? Let's go back. I'm not sure if I'm doing the controlling here or not, but we'll get through that. So it's a free resource. I want to emphasize that. This is something that we can all access and all use. A free resource designed by Great Ormond Street Hospital in partnership with GAP, with Global Action Plan. And it's to enable hospitals to understand what it means to be a clean air hospital. Hospitals are obviously complex systems, lots of inputs and outputs. So it really brings that together and makes it easier for a hospital to understand that. It also allows a hospital to self-assess progress against 7 key elements of what it is to be a clean air hospital. The 7 key elements include transport, include education and engagement, etc. And that's great. How to develop an action plan, so a bespoke action plan that a hospital can then deliver on, and to assign ownership within the hospital to take these actions, and then to track and report progress as we go along. So fundamentally, it's about improving air quality inside and outside of the hospital and minimizing sources of air pollution that we have control over. So the leadership in that respect, there's an advice element. So how we as an organization can educate our staff and get our staff to communicate with patients as well. And then finally, how we can be role models as an organization, how we can work to change the agenda, to become part of. Yeah, that would be great, Catherine, if you don't mind.
Hello, and we seem to be having some issues on the technical side, so I'm just going to suggest our lovely technical team, maybe if we take the slides off for a minute and just sort out, they seem to be on automatic, and maybe Nick and I can just have a quick chat while we sort that out. So sorry about that, and sorry for
okay.
people watching. So Nick, I know you're going to cover a little bit more about the kind of hospital framework and its origins and how we're kind of rolling it out. But I guess it would be also interesting while we're sorting out the kind of technology side. So are you aware of any other hospitals that are using the framework at the moment? Has it gone beyond kind of Great Ormond Street so far? And kind of, yeah, where else are we seeing it at the moment?
Well, I believe it has. Peers that I speak to are using it. To what degree, I don't know, but it's certainly something that, as I say, it gives a nice structure to what is quite a complex problem, complex sets of inputs and outputs. So it sort of brings it all together and brings a blueprint. So I know some of my colleagues, I think in Newcastle and other places, are certainly using it at this stage, and yeah, really keen that more continue to do so. Let's have a look how that's working.
Now I can see it looks like the slides aren't jumping around anymore, so maybe if we can take you back to where you were.
Are you controlling or am I?
I'm not controlling, and we have a fantastic tech team who have been supporting. Maybe
well, let's carry on from.
Let's see, yeah, how we go
from here. My apologies all. Okay, so breaking down from here, we're looking at 7 key categories. We're looking at our deliveries, our procurement, who we're buying from, what we're buying, do we consolidate our deliveries? Secondly, we're looking at design and construction, how we design our buildings, how we ventilate them, etc. Thirdly, we're looking at the local community, the local area, how we engage with them, what we do to influence, have influence positively or negatively on the local area. Energy generation is key, how we heat and light the building. Communication and training, how we train ourselves, educate ourselves, but are also able to do the same with our patients. NHS staff, medical staff are trusted messengers, so that's key. Hospital outreach, how we engage with our local community, and then travel planning for staff, for our contracts, the vehicles we use in our fleet. So this is just an image of what a clean air hospital might look like. This is actually a board that we use and we take round to work with patients. It has magnetic stickers on, so it's a really nice way of having a dialogue with our patients. But again, it's covering their community, indoor air quality, infrastructure that we are going to need to invest in the hospital, etc. So really we'll get onto this, but it's about simple actions, but there are some more complex and systemic actions as well which need to be taken, which we'll look at in the next slide. Okay, this is an example of one page, our travel page. For example, here is hospital travel planning. Simple action here. Basic is worth a point, getting there is worth 5, and excellent are worth 10 points. So for example, providing basic information for staff is a 1-pointer. We can all do that. But in the excellent column there, we're talking about working in partnership with the local authority to ensure planning and development decisions minimize air pollution. So that's much more systemic, takes time, and they're worth 10 points. So as part of our tracking process, we're looking at building up to actions like that. So again, the framework takes all that into account and starts to really factor in progress in that respect. Okay, so how did we create the framework? Working collaboratively was really important, and we worked internally with teams from across the organization. We ran workshops to understand how can we deal with this problem. It wasn't something that people had thought much about, but it was necessarily to get their input from across the hospital. Externally, we worked with many different organisations, the WHO, NHS England and others, to get their input. So with the activities that we created were real, they were precise, and they were realistic as well. Okay, so let's go from here. We will. Okay.
Nick, I think it's jumping again. I might just ask our tech team to help, but I just had a question on that in terms of engaging kind of all these different stakeholders, because certainly, you know, when I've spoken to other hospitals, they've said it's a real struggle to try and sometimes to get everybody in the room. You know, that everyone is really, really busy, and kind of that's often the starting question that we have at Global Action Plan when we're talking to hospitals. They're like, you know, what's the most effective strategy in terms of making sure that you are engaging with all of those different stakeholders?
Well, I think yeah, it's demonstrating how this is relevant, how it's actually going to potentially help with your processes to make things more efficient. But it's, yeah, also there's to some degree a little bit of insistence there that this is where we're going, this is the direction we're going. There's some leadership saying that. So once you bring people together into a room and you get a realistic understanding of what they think are the barriers and what they think is possible. So we start from a sensible baseline and create activities to move on from there. And I think that session itself is educational and helps in building that belief in what we're doing. So we did that. We created it collaboratively. We had lots of input externally as well. So in terms of the type of engagement that we took part in, we have some examples here, but we may see them, we may not. But basically, there were lots of simple, for example here, simple messaging that we start to get across the hospital in regard to how air quality can affect your lungs, because that's the basic kind of information that we start to put up. Followed on from here, so messaging around the types of actions that people can take, the types of actions they should be encouraging with patients. Working from home a lot, so keeping your home ventilated, often forgotten the indoor air quality side of things. Obviously in the hospital, indoor air quality is very good. And taking quieter routes, etc. So transport, so some simple messaging around this type of thing. And then some more involved. These are laminated cards we work with the children with and look at the source, symptom and solution of the problem. The source is a lorry, a building site. Some of the symptoms that we'll move on to here are coughing more, visits to A&E, and some of the solutions are avoiding heavy traffic. So breaking it down into a slightly more involved way. Of course, we're just still talking about education side of things here. Then we move on from there to again, more involved forms of involvement. This is artwork with our children and our teams here. So some lungs, a bicycle, non-smoking. So we start to engage that way and then use these as methods of communication with the rest of the organisation. Simple activities here, my clean air superheroes. So some of the children here, Nikita has created a clean air tree, which is sweeping up all the dirty air, again, because we don't want to breathe clean air, dirty air. So it's starting to get the children thinking more about that type of element. We'll move on soon. Here we go. And again, this was with a more involved communications campaign we're running. This was a particular group around cargo bikes. So they're looking at how they can create a film to encourage us to get more cargo bikes, less, consolidate our deliveries, etc. And you can see they've broken that down into quite a lot of detail. So again, our children are pretty much at the heart of a lot of this decision making, or a lot of the creativity as well. So moving on, educating some of our contractors, so working with some of our patient transport teams about idling. We did this with Global Action Plan, not idling outside the hospital, eco-driving in general. So that was all extremely positive. There's lots of angles of that. We're starting to link into the service we provide beyond the education side of things. And then hopefully we'll move on to outreach and innovation. This was a really lovely example. The previous work built our confidence to start to take more systemic actions like this. Here we closed Great Ormond Street and turned it into a playground for the day. This involved some systemic changes to how the hospital functioned, but we were able to get through all of that, and working with our security team, our sustainability and play teams, we created this environment with a racetrack, with ceilidh dancing, with all sorts of activities. We basically took a very busy, polluted and congested street and made it a playground for the children and local community for a day. So a really good example of visualizing the future. This really moves on to the infrastructural changes that the framework is allowing us to really consider. It allowed us to really visualize what this road should look like, a resource for us as opposed to a negative when people arrive at the hospital. Again, some of the children hadn't left in many months, the hospital. And again, it was about building the confidence for staff to bring children out and to really enjoy this space. Again, we'll be linking this into our future development plans as well. Well, we may be able to move on. Here we are, one lad. He was had a borderline obsession with the fire brigade and was very lucky that we had the fire brigade there. Again, it's a chance to link in as anchor institutions into our local communities. And he had a great time with the fire brigade. He'd made his own hose out of cardboard. And here we go again, engaging with the local community, looking at idling. This was volunteering with our local authority and local volunteers. Okay, measuring and monitoring. We've got measuring and monitoring equipment on the street for particulates and NO2. We'll show you a graph here. Often we're over WHO levels, but you can see on the right, the red mark is where it went when we closed the street. So really positive there. And again, it's about starting to normalize this type of data and the fact so people start to think about air quality. Please shout me, Catherine, if I'm time-wise. So yeah, normalizing the data is absolutely key. And this moves on to the broader infrastructural place that we're getting to now through work through the framework around public realm, how important that is for our children, for our relationship with our local area. So this is Great Ormond Street on a very quiet day, I must say. But if you look from the left, poor visibility, no separate cycle paths, that poor cyclist there, people smoking there and parking on both sides. It's very congested. So we're looking at engaging staff through the framework type activity in a process of developing this and the public realm around us more broadly. So I'm going to show you the way that we're looking at doing that here. So again, we've broken it down. In the center, we have 2 lanes of traffic, narrow path on each side, really unsatisfactory really currently for what we want, and the play street obviously demonstrated how that can be a whole lot better. We'll move on to this next slide here, which demonstrates if we made it one way, we would have in blue here a cycle lane with the pavement on one side, but frees up space on the other side for a barrier of planting, for other types of activity there, and a pavement as well. So this is another alternative that we're looking at and engaging staff with, again on the back of the education work that we've been doing over the last year. So potentially we'll get to the next slide shortly. This is an overview here of what it looks like from above. Very congested at the moment, lots of parking, quite an aggressive place sometimes in terms of people losing their temper. Not what we would want ideally. And then moving on to where we will want to be over the next year. We're going to be doing more activities, pop-ups, pilots, play streets, parklets. Hopefully with our local authority, we're looking at that to again test the options that are available for us, building up to our broader vision in a few years' time. We're involved in building a cancer centre on Great Ormond Street, which will change the facade and relationship with the local community, we hope very positively. But during this construction phase, 2022 to 24, it will become one way. So we'll use that opportunity to measure, monitor and trial more activities, leading our way up to, as you will see in the next slide, our vision for 2025, which is a slow, child-friendly street, wider pavements, activity opportunities there all the time, and a real asset for us with greening, with other types of activity the whole way along. So really this is how it starts to feed into this, how it starts to feed into where we are now, which is a relatively hostile, the opportunity to pilot, gain data, build interest and support leading up to 2025 with a completely transformed street, public realm, relationship and access into the local community and vice versa. So that's very exciting. Again, it taken a bit of time, but lots of engagement, and especially with our young people on that. And then finally, we will move on to the COVID situation and how that's impacted on our work. So firstly, I'll lay out that we've created a safe, sustainable, active and sustainable working group to look at commuting and staff getting into work, etc. This has created a cycle to work group, which is very supportive. We're looking at our cycling infrastructure. We're looking at we're registering bikes, helping people repair bikes. All of this is starting to be built around that, and we're about to start an electric bike partnership as well. But this was a piece of analysis we did about where our staff live and how they commute in. Now this is going to be fun because there's lots of moving from slide to slide here, but fundamentally we analysed where all our staff were coming from in terms of their postcodes, and we broke it, we're A in the middle, and broke out into zones around the hospital from central London. We broke this down into how many different people are in these different groups. So we have A, staff have the opportunity to walk to Gosh, B, 25-minute walk maybe to Gosh, or a 15-minute bus ride, C, a 40-minute cycle ride or less, D would be above a 40-minute cycle ride, so much more committed cyclist, or the electric cycling option. E is outer London, which would be reliant on a train hub, but there's a choice of transport in from the train hub. Lots of these people sometimes were driving in during the first wave of COVID. So again, it links into trying to work with them on the next wave. And then finally, F is outside London, and how we can work with staff to get in from train hubs in a safer way, but also in a way that causes less pollution. So we're nearly there. We have employee numbers for approximately for each of these categories. So it can help us direct our messaging and direct our interventions. So for example, walking to work is fine. But if we go into group C, an easy cycle, that's 1,300 people we can work with on that. Of course, you won't have everyone, and some people won't want to cycle. Group D, again, a large amount, 1,300 employees on a longer cycle, or the electric bike option. And then E and F is again about hybrid journeys, which of course ties into our health and our well-being and our choices that we have. And just a little visualization of this, Gosh in the middle, our local train hubs here and the number of employees. So Euston, St Pancras, 605 employees would probably be coming into there. And if you broaden it out, these are 20-minute walks into work, something people don't necessarily obviously think about. And then out to the other trains here. So Liverpool Street, 212 employees, Waterloo, 112, Charing Cross and Blackfriars. So again, it's starting to get these messages out, which we're doing slowly. We're working on these at the moment and having the interventions to try and support some staff to make some other choices. Just finally, this is the geographic postcode areas that we used to break this down. Again, this is just rushing through it. And then finally, our next steps. We will be linking that work into our HR and into our health roster. So it's much more formal, so we can hopefully target our communications and activities even better. We're going to have a phased approach to that public realm transformation, building up to the Children's Cancer Centre in 2025. A phased and engaged approach to doing that, evidence-based as we go along. A major campaign of education with our clinical staff working with patients. We're going to be pushing that over the next few months as well. Supporting the local authority, Camden, around low traffic neighbourhood work that they're hoping to do around Holborn. So we're going to be giving advocacy around that and trying to involve other healthcare institutions where possible. The Clean Air Hospital framework, so dissemination of that where possible across the health sector, because really a clean air movement is necessary here. And we believe that could be one part of doing that. and generally much more collaboration around with tech, potentially with infrastructural organisations, with education organisations. We and obviously others will want to be doing that, so we hope to do that over the next year. And finally, we'll continue to be led by our children and our young people in terms of ideas, but also governance. Our strategy, new GOSH strategy, a 5-year strategy, has just been released. And Great Ormond Street will have 6 guiding principles, one of which will be protecting the environment. So that's a fantastic step forward. And obviously the NHS's net zero by 2040 goal, which came out last week, which is of course hugely exciting for everyone. So we look forward to be linking in with that. That's me for the moment, Catherine. Thank you. And thank you all for your patience.
Nick, thank you so much for that presentation, and for you. Oh, hang on, let me turn on my video. There we go. Thank you for your patience with the technical issues. So sorry for that. I just wanted to. We're going to take a few questions. So if anyone has questions specifically on the Clean Air Hospital Framework or actions hospitals can take in terms of improving air quality around sites, please make sure you're including them on the Slido chat. I just wanted to frame the Clean Air Hospital Framework in terms of some of the wider work that GAP's doing. I just wanted to flag. So we're currently doing work with the Royal Free, with Royal London, with Whipps Cross, the Whittington and UCLH on a Clean Air Hospital Framework. So the idea is we'll be going into those hospitals and, well, actually we're more likely to be doing virtual workshops with them, looking at the Clean Air Hospital Framework and creating action plans for those hospitals to improve air quality around those sites. So if you're based in any of those hospitals, I'm sure you'll be finding out more. We're also going to paste in the comments box just a link to the Clean Air Hospital Framework. So if you work in a hospital and think they might be interested in finding out more, the link's there and you can download it. And the idea is it's a tool that you can, the hospital can use itself, or if you do want support, please do reach out to GAP in terms of facilitation, particularly on developing action plans. Okay, so in terms of questions, so I've got, I think one of the first ones, which you touched on a little bit, which was how are hospitals working with local councils to improve air quality outside? And so obviously you touched on street space and some of the all work with Camden Council, but I don't know if you have any other kind of wider recommendations for trusts or hospitals in terms of working collaboratively with councils.
Yeah, Camden have got a great air quality team. Generally, councils may have that or a sustainability team, so link in with them, and also transport, really important to work in with them. A baptism of fire for us was the closing the street, and it gave us all an opportunity to work together with a bit of rigour around an issue that was quite administratively heavy and other things, but that worked really well, and that really has helped create the relationship. So we were looking at parking suspensions and all sorts of closing streets and things. So we've done that. Now we're looking at things like, which many local authorities will be looking to do, hopefully, is low traffic neighbourhoods and the broader piece there of supporting and advocating for that, because we know how beneficial that type of thing will be to us, to others in the area, to schools, to hospitals. So I suppose it's, yeah, for us was a staggered approach, but they're the teams generally to work with.
Okay. We had another question earlier that was emailed in terms of for hospitals where budget is very limited, so say if that's their kind of starting point, what would you say, kind of where should they put their energy if that is a stumbling block?
Well, I think at the moment people are quite becoming more aware and mindful and concerned about these sorts of issues. We're in a point where Zoom meetings can be organised within a hospital, so you need to work with leadership. But I think we can, you can get together a session on this and have hundreds of people turning up to it. You need to think about what you want to get out of that and think about how structurally with the organisation you're going to move on. But I think you can create a lot of will, a lot of momentum for at the beginning for very little cost. Then you can start to find advocates in different areas and start to drill down on actions that need to be taken. The framework has done a lot of that for you. But there is a lot of engagement that still needs to occur. But I think you can begin by doing something like that and assessing what's going on. There's also lots of local partners that you will want to link in with as well, which is very necessarily. But you're looking at your service heads and other people like that as well. And these are things that they will be integrating into their contracts as we go forward anyway in many organisations. So again, you'll be giving them a head start.
Okay. And then linked to that, I think we kind of touched on it in my question earlier, but somebody had to kind of, what has been the greatest challenge you faced in terms of engaging internally? So I know we were talking earlier about how you get everyone in the room, but are there any other challenges that you faced, that any other examples you can give to us, and how did you overcome them?
Well, we've still got an awful lot of engaging to do. We haven't engaged with everyone by any means at all, but we did engage in order to create the framework and start on these different activities. Often it begins with, I think, with focusing on particular activities that are tangible and people can get quite passionate about, and then it sort of moves on from there. But yeah, I think if you have the opportunity to just put out the fact that this is on the agenda, that's a really good start, and then get people's input as to which are the areas of focus. And I'm sure but there'll be people coming back. As I say, we have people leading on our cycling side of things, leading on going out and advocating in the local community. We've got lots of local community members doing the same. So I think it's different for every organization, but you need to, sow the seed and have a structure there for if it takes off. But again, this isn't necessarily costing money, but it's time, and it's that will. I think you've got to go in with the approach that might be there, especially if you structure it correctly, structure the way you're communicating correctly, and also involve the right people, because this needs to be done. I think organizations know that now, and it's not actually a draw on resources. It's about efficiency. COVID, it links in very, very strongly, obviously, to that from a medical perspective and a practical perspective about getting to work.
So linked to that, so we've had a point just coming in, encouraging working from home and completing virtual consultations are also a huge factor in reducing emissions. Do these play a part in the framework?
Well, definitely. A lot of these things have happened, irrespective of it. Complete transformation in some regards, in terms of that, and people are formulating how they feel about that. But of course, our virtual appointments have rocketed. Working from home, the same. It was very rare before, and that is working well in itself. So absolutely, and we'll be looking to how to regain that data, but how we obviously make on the well-being side that as good for everyone as possible, and just be mindful of watching that and checking that it's all going in the direction that we want in terms of care, but also in terms of staff well-being and everything else. So that's an unintended positive consequence in some way, but still needs close attention. So we'll focus on attending to it and seeing the direction that it's taken, and that it's still all on track.
Lovely. And another question in. So do most hospitals have heads of sustainability who are able to lead on the framework?
You don't need to be a head of sustainability, I don't think, to lead on it necessarily, but you do want to find an advocate, senior, higher level advocates, of course. And I think, again, this agenda is, you'll probably find one. So I wouldn't say you do. There are our Cycle to Work group, and some people are putting an awful lot of time through that and other elements of this while doing other jobs. Yes, we have built momentum, but there are people like that in all organizations who will be driven to do that. And I think, you will push it up the agenda through that. So no, I don't think you do, but it's obviously helpful. But bear in mind, my role it relates to climate, to broader sustainability, to energy, to waste. So this is one facet, but one that people are very passionate about, can really relate to. So I don't know if you do. Of course, it's helpful.
Lovely. Okay, the next comment I wanted to make, so somebody had made more of a comment than a question, but I thought we could add to it too. So somebody had said, Parklets are great, let's have worklets too, sitting outside for more green space. Councillors could provide Wi-Fi, good for mental health too. So I know that was certainly, when I started at GAP, it was one of the examples given from kind of a hospital, in terms of, a quick intervention where there are spaces that were identified outside that weren't being used, and actually were really important in terms of kind of supporting mental health. I don't know if you have any reflections on that, and also any other kind of quick interventions you've seen in addition to those you've mentioned that you think had a real kind of impact at the start.
Well, yeah, the Parklet, the Parklets that we're looking at with Camden, it's a great thing that Camden are doing there, looking at a whole a series of Parklets potentially, and we would focus that on our staff and maybe local community as well, not so much the children necessarily initially. So, and that could be a multi-use space, which will evolve as we go along and see how it works. And absolutely, that could be for a bit of work. It could be for having a meeting in a different context, a more stimulating environment. It could be around particular subjects. It could be a way of consulting locally in this space. So I think we'll have we will use it with that approach, and we'll develop ideas for what works best as we go along. But I absolutely agree, that's great. We hope to have 2, and then you would have more, because it would make sense to do that. Obviously, we'd be taking up parking spaces, but potentially that's a positive as well, as long as we've worked out you know, what the repercussions of that are. And then in terms of other interventions, well, I mean, in terms of the sort of the ones that impact people on a deep sort of emotional level, but do involve some serious logistics, the things like the Play Street work was very much that. You had to really analyse the workings of the hospital, risks in a very serious manner, external and internal, and make sure you were confident covering all of that off. But the result, and it needs to be done properly, was a massive partnership network, a co-collaborative, a creative process, but also people, I think, impacted on a deeper level, and a visualization of what's possible. So anything like that's obviously good, and they can be done on smaller levels as well. And I'm really happy to talk to anyone about our experience, of course.
Super. Nick, thank you for answering those questions. I'm going to suggest we move on to speak to Laurence, who's with us from the UK Health Alliance. Although, Nick, I'm hoping you'll stay online just in terms of wider questions, because I'm sure you have lots of a wealth of input and knowledge on these topics. Laurence, we were hoping that you can tell us a little bit more about the Mobilising Health Professionals project, which is kind of more focused not just on hospital sites, but actually the really important role for health professionals in terms of talking about air pollution with their patients. So I know you're going to kind of do an introduction, and then I'm going to cover a little bit of content from GAP on that too.
Yes, fabulous. Thanks, Catherine. Did you want to put up those insights as well, or in a second perhaps? I'll just start with a brief introduction to the Alliance and what the project is really quickly. So hello, I'm Laurence. I'm from the UK Health Alliance on Climate Change, which brings together health professionals to advocate for responses to climate change that protect and promote health at the same time. And so our members include most of the medical royal colleges, the Royal College of Nursing, the BMA, and the 2 leading medical journals, the Lancet and the BMJ. And air pollution has been one of our sort of major focuses of our work. Two of our members, the RCP and the RCPCH, have recently put out reports on indoor and outdoor air pollution, and we also put out our own paper a while ago, which is a sort of policy recommendations paper. So most of our work until now has been about advocating to the UK government, for example, around the setting a net zero target and around the environment bill and how that could be used to improve air quality. But with this project that we've been working on with GAP, it's kind of our first foray into mobilizing health professionals, that's what it's called, and engaging with the individuals rather than with the organizations that represent them. So we think that health professionals have always had quite a big influence over people's behavior, and I think that in a time when everyone's so used to listening to health advice and realizes the importance of that, I think that influence is probably greater than it has been before. So a while ago, GAP and UK HACC, that's us, asked some of our members what they thought about the role that health professionals could play in providing advice to their patients on how to protect themselves from air pollution and how to help to reduce that problem as well. Do you want to pop up those insights, Catherine?
Yes, my very kind colleague is hopefully going to bring them up in one moment.
Fabulous. So start from the top. The first and most important one is that health professionals are willing to provide advice on air pollution. So that's obviously a good starting point. They also said that the ways that messages are communicated have to vary between professions and according to the groups that they are aimed at. And obviously, in addition to this, we've found recently that the ways that health professionals can communicate with their patients have also changed dramatically because of COVID. So in our most recent workshop, we found a lot of people saying, suggesting that perhaps at the moment physical materials might not be the best way to do it, and face-to-face consultations aren't quite as regular as they used to be, obviously. So so we've, as Catherine will probably talk a bit about in a second, the materials that have been produced to help health professionals get these messages across are designed to be specifically aimed to certain patient groups. While those messages do need to be targeted at certain groups, and we've started with respiratory health professionals and patients and pediatric patients, it's also the evidence is also clear that air pollution damages every organ in the body and not just those that you might think. So, obviously respiratory patients are particularly vulnerable, as are children, but the evidence is clear that we need to get these messages across to everyone and not just those people. And from the sort of experience that we've had in getting people to sign up to the workshops, we found that lots and lots of different health professionals are also keen to get involved and recognize the importance, even though it might not initially seem central to their patients' issues. They also told us that patients shouldn't be made to feel responsible for overcoming the challenge on their own. And that's probably where the rest of our work comes in, the sort of political advocacy, is we've been working for some time on campaigning for changes to legislation to the Environment Bill, which actually has at the moment been paused for about 200 days, over 200 days. And so the main change we want to get there is to strengthen the legal targets for PM 2.5 pollution, which has probably been mentioned a million times already today. But I'm going to talk in a second about how other ways that health professionals can help that to happen. And just as patients shouldn't be made to feel responsible, also health professionals the burden shouldn't be all placed on them. So they need a resource that they can refer to get extra information, but also that they can refer their own patients to. And I'm sure Catherine will talk in a second about that. And that in this project is the Clean Air Hub. And lastly, to make the biggest impact, air pollution needs to become part of professional training and development for health professionals. This is probably the trickiest item of feedback to react to, because there's always going to be a lot of competition to get anything into the medical or nursing curricula and training, and that takes a lot of time. So through this project, we're hoping to demonstrate that it can be effective to train up health professionals to advise their patients on air pollution, and thereby encourage the people who need to buy into the changes, that it is a good idea to make these changes more broadly about training. And just before I hand over to Catherine, I'll just say a few more things about other ways that health professionals could make a difference to air pollution. So firstly, we've talked about political advocacy. The UK Health Alliance on Climate Change is soon going to be launching an online advocacy platform that we intend to use to enable health professionals to urge their MPs to support changes to the Environment Bill. And so that's not quite live yet, but if you follow us on Twitter at UK Health Climate, you'll be able to find out when it is. And they can also obviously lobby their places of work to do things like taking up the Clean Air Hospital framework that's been talked about, or indeed the Green Impact for Health toolkit for GPs. Or you can join your hospital's green group or start one. There are lots. Barts has got a good one, Green at Barts it's called. And lastly, as also already been discussed, the NHS has made this big commitment to achieving net zero, which is obviously going to improve the air quality as well associated with, and reduce the pollution associated with the NHS's activities. So if you don't know about that, you can go and read it and even just raise awareness by sharing it with your colleagues. Catherine, I'll hand over to you.
Laurence, thank you so much for that introduction. It's much appreciated. What I was going to do just with our remaining time is, first of all, I wanted to share a video with the group. So it's really frontline perspectives, particularly with some of the individuals who've been involved in the project that Laurence mentioned, really sharing their experiences of why it's so important that health professionals can talk to their patients about air pollution. And then I'm just going to briefly cover some of the resources that we've created through the project and how you can get more involved. And then we'll have a little bit of chance for Q&A. So if it's all right to bring up our health sector video, please. Thank you.
I regularly see patients who are impacted by air pollution. I work within the hospital and also within GP practices looking after people with respiratory disease. Many of the patients, we can actually probably say that air pollution has contributed to their actual diagnosis of respiratory disease, such as asthma or COPD, as well as many of the patients I see, their control is exacerbated by air pollution. Many of the COPD patients may have symptoms of sputum, increased shortness of breath, wheezing caused by air pollution, and also very similar for asthma patients as well.
I really commonly and regularly see patients who are impacted by air pollution. I regularly, on a weekly basis, diagnose patients with lung cancer who have never smoked. Much of their risk comes from air pollution.
It's very important for people with respiratory issues to receive information on air pollution so they can, for instance, understand that, for instance, when there's a spike in air pollution, what impact that may have on maybe their asthma or things like that.
So I'm really concerned that healthcare professionals, doctors, nurses, whatever, have never raised the issue of air pollution with me and with my small children. And in particular, we were living on a busy road in Brixton. My son at 10 weeks was hospitalised for 2 nights with bronchiolitis. And only much later did it occur to me that there could be a link to air pollution.
Unfortunately, I do not think that healthcare professionals have enough resources and certainly almost next to no training in discussing air pollution, both with their patients as well as their friends and colleagues and decision makers within their organisations. I got interested in this and really had to do my research. In 6 years at medical school and now 17 years as a consultant physician, I've never once, unless I instigated the training or invited an expert speaker to come to us, have ever had any training on air pollution, despite it being something that kills 40,000 people a year across the UK.
Healthcare professionals do not have enough training and resources to support our patients with the impact of air pollution. During my training through my career as a consultant pharmacist, I have never received any training on air pollution, only what I've received through the media and from reading. I would like to see the health sector support the training and education of all healthcare professionals, but particularly with pharmacists. We should start to train our pharmacists right from undergraduate level all the way through their continuing professional development to be aware of the effects of air pollution so that all of us can support our patients in making sure they have the right facts and can avoid the effects of air pollution going forward with their disease.
Doctors are the right people now to be fronting this message. So that's what the health sector can actually do. And it will also be nice to go into a hospital where there are leaflets there about different things. And it would be nice to actually find one on air pollution and the damages it does to the public's health, because it's from the cradle to the grave.
We all believe and trust so strongly in our doctors, our nurses, our midwives, and we really need you to be telling us that we need to take care on big roads, walk on back roads, think about when to open our windows, to drive less.
when I used to take my late daughter to hospital. And I must admit, getting her to Great Ormond Street, there was lots and lots of pollution on the way there. And I think directly outside the hospital was very important, because one of the things she used to complain about was people who were smoking outside the hospital. So maybe if we look at air pollution in a similar light, if air pollution is impacting on your breathing, then you shouldn't have idling cars or ambulances right outside entrances of hospital. So maybe hospitals can show their patients they are taking air pollution seriously, and this will help in discussion with their patients.
I would very much like to see a health campaign for air pollution, very similar to what we see with stop smoking, with flu vaccination, with weight loss. All of these are very important public health messages where we need to increase the awareness to our population.
I would say in addition that as scientifically literate and caring healthcare professionals, we have a responsibility as educators and activists to get the message out there. And that has to form the basis of a public health campaign based on science and evidence.
Hello. Thank you for your patience with watching that video. We think it's really, really important to hear some of those kind of frontline voices of people describing why this is such an important issue. I'm conscious of time, so what I'm just going to briefly do is on our slides, I think if we could go to, if we can bring up the slides, and I'll flick through them just to the ones I really want to make sure we cover before we close, if that's okay. While I'm just waiting for those to come up, so I guess I just wanted to first of all just to reiterate that brilliant, thank you very much. So on Clean Air Day, one of the kind of key messages that we've given throughout the day is that everybody has a role to play in terms of creating clean air. And, you know, certainly in terms of the bigger picture, we're looking to government to support, whether that's with things like the Environment Bill or ULEZ or clean air zones. We also do think there is a role for organisations, and that's why tools like the Clean Air Hospital Framework are really important, but also a role in terms of individuals and taking, making sure that we're kind of making decisions linked to low pollution behaviours, whether that's trying to walk and cycle more for short journeys, whether you might be switching to an electric car. So we've certainly been looking at kind of different examples that we can be giving to patients. I just wanted to flag that the government has recognised the important role that health professionals can play in terms of supporting this movement. So this comes from the Clean Air Strategy, which was released last year, which highlighted the fact that we need to equip health professionals to play a stronger role by working with the medical and royal colleges and also the General Medical Council to embed air quality into health professionals, excuse the typo, education and training. So since that strategy came out, as kind of Laurence introduced, we've been working on this mobilising health professionals project to try and really test messaging with different health professionals to share with their patients. There's also been the launch of the Clean Air Hub, so that's a go-to place where you can send patients to find out information about the sources of air pollution and also what patients can do to protect their health. We've also seen air pollution kind of as a priority in terms of Public Health England's new 5-year strategy. I also just wanted to flag that there was an event held yesterday which was called the Clean Air Day Health Summit, where GAP convened alongside with the UK Health Alliance key decision makers from across the health sector and environment sector to look at specifically the issue we're discussing today. And I just wanted to flag that kind of some of the kind of key report from that event hasn't been shared yet, but kind of some of the key discussion points that were coming out from those decision makers. So they were talking about the need for kind of the performance driver on sustainability, so looking at accountability linked to tackling air pollution, and the need to scale up good practice. So really, how can we look at making sure things like the Clean Air Hospital Framework and good practice across different hospitals is being shared and driving change. We also looked at the need to collaborate and learn with from the private sector on this, and also, I mean, there's certainly a very, very strong push in terms of the need for a public health campaign and looking at how we can mobilise that. I also just briefly, if it's okay, we scroll through the slides, there's just some examples of some of the resources that we've created. So with the Mobilising Health Professionals project, as flagged, it's a piloting project, but we're going to share a link in the chat bar. It may have already gone up, but we have now created a number of resources, particularly for respiratory health professionals and for child health. And that includes short leaflets and long leaflets, and also posters that those health professionals can use to share in their health settings and start communicating with their patients on air pollution. And we're going to be developing an insights report from this project, looking at how this could be rolled out nationally. If you would like to find out more about the project, feel free to get in touch. We'll include links, and we really want to encourage as many health professionals as possible to be involved. So please do link up and find out about what we're doing. And with a few minutes left, I just wanted to see if we have any questions from the floor. So I'll just have a little look through. Okay, so we had a question, I guess this is to Nick and Laurence, on why do you think the health sector hasn't taken action quite in the way that we would like so far on air pollution? What's been the stumbling block? Nice big question for you there.
Yeah, I think it's certainly time to do it now. Why it hasn't been done so far? I think there's other priorities. Well, there have been perceived to be pressures, and for whatever reason, it hasn't risen to the top in terms of urgency. And maybe that's, I know public opinion is changing, but maybe that's taken a while as well, potentially. Maybe it's some way in line with that, but I agree. Things certainly, there is a massive opportunity that needs to be taken, you know, now and quickly. And I think it probably hasn't, and that's really just needs to move on. I'm not entirely sure why.
Yeah, I don't think I've got a better answer for you, I'm afraid. I think that health professionals have been involved in lots and lots of different campaigns over the years, smoking, alcohol, all these sort of things. Perhaps air pollution is just a little bit, feels a little bit more passive. You know, it's so ingrained in everyone's life, and it's not quite such an active decision that we, you know, that just like right at the time you can tell that it's affecting your health. Maybe that's something to do with it.
It was interesting as well. I mean, I certainly have heard reflections sometimes on the projects that we've done that it just feels like too big an issue to start off with. And I think because it hasn't been included in kind of medical training to date, that health professionals kind of reflect and they didn't know where to start. So I am kind of very hopeful that some of the resources that are being created here can be a kind of real starting point, but also making sure that this is kind of integrated into training at the earliest possible moment. I'm being told that the next session is about to start, so I just want to say a massive thank you to Laurence and Nick for your time on this session, and to all the health professionals and others who've joined today. Please do continue to engage, and as I said, we'll share all of the links. This work is ongoing, and we really want to make sure as many people from the health sector are as engaged as possible. So thank you. Bye-bye.
Thank you very much.